I'm Jennifer Carson, and I'm director of the Dementia Engagement Education and Research Program, or what we call the DEAR program. I'm based in the School of Public Health at the University of Nevada, Reno. I'm also a clinical associate professor in the School of Public Health, and I describe myself as a critical gerontologist. I have a very interdisciplinary background, but have been supporting older adults with a special focus on people living with dementia for over 30 years now in a variety of different positions. I'm also a family care partner. And so I just think it's important to share that I am bringing that perspective to this presentation and to my work every day. I have a parent who is living well with Lewy body and vascular dementia up in Washington State. So, Krista, would you like for me to just go ahead and jump in?
You can, if you're comfortable, we'll just keep going. Thank you, Jennifer.
Okay. Well, thank you for this opportunity to share about navigating dementia, charting your path to well-being. We're very excited to be part of this Brain Care Summit and to be partners with the Virtual Brain Health Center on a program that I'll be sharing this morning. So these are the objectives for our short time together. I'm going to briefly describe the impetus for the development of the DEAR program's new free dementia self-management guidebook. And then we're going to explore some of the complexities of this notion of dementia self-management. We will also review the collaborative process that we used in partnership with people living with dementia to develop this new free resource, the Dementia Self-Management Guidebook. And then we'll learn about the new free dementia self-management program that we're offering in partnership with the Virtual Brain Health Center. And that program's based on the guidebook and it's offered in person here in the state of Nevada, but thanks to the Virtual Brain Health Center, it's also offered online. But before I jump in, I do want to thank our funders because this work would not be possible without the grant support from the Nevada Division of Public and Behavioral Health. The DEAR program is a sub-award recipient on their BOLD grant from the Centers for Disease Control and Prevention, or the CDC. BOLD is a legislation that passed some funding to federal agencies and then to the states to help us build our largest dementia infrastructure, BOLD, B-O-L-D, building our largest dementia infrastructure. And we're very honored to be a part of this CDC-funded program. I also want to take a moment to thank the contributors to this project. I get to be the spokesperson today, but this is very much a collaborative effort that involved many people that you see featured here on the screen. In particular, I would like to acknowledge and express my gratitude to a dynamic group of people who are living well with dementia in the United States. These were our advisors on the Dementia Self-Management Guidebook that I'm going to be sharing this morning. Jim Lone, Chuck McClatchy, Nancy Nelson, Barbara Stockton, and Yvonne Sweeten are all Nevadans. And we are joined by our friend Sam Simon, who's based in Virginia. So I'm going to talk more about what it was like to partner with our friends living with dementia in developing this new resource. First, a little bit about the DEAR program, just to contextualize this a bit. We are a university program. As I mentioned, we're based in the School of Public Health at the University of Nevada, Reno. And the DEAR program's mission is to build capacity at 3 different levels: the individual level, the organizational level, and even at the community level, to improve the experience of living with dementia and care partnering practices in Nevada and beyond. We are deeply committed to something called authentic partnerships. Authentic partnerships is that commitment to a nothing about us without us approach to the development of education and research initiatives. And so we're very committed to that. I'll talk a little bit more about the supports and enablers of authentic partnerships as I share more about this project. And we are very committed to collaborating with other agencies in this space, such as the Virtual Brain Health Center. The DEAR program has a number of grant-funded initiatives from various agencies. We're a small team, but we're doing a lot of work in this space. But this project is really the intersection of two grant-funded initiatives within the DEAR program that I'll talk just a little bit more about. And that's the BOLD grant that we're working on, but also the Dementia Friendly Nevada grant. And we receive funding from both the Nevada Division of Public and Behavioral Health and the Nevada Aging and Disability Services Division to help support the Dementia Friendly Nevada effort. The mission of Dementia Friendly Nevada is to really work in partnership with communities to help them become more respectful, educated, supportive, and ultimately more inclusive of people who are living with dementia and care partners who often find themselves somewhat marginalized and isolated in their experiences. The DEAR program has the honor of working in partnership with 8 different communities across the state. And you see them pictured here on the map. These communities represent tribal, rural, and urban communities in our state. We host these monthly meetings every month for about 2 hours per month, both at the local level and at the statewide level, engaging all partners. And typically the members of these community groups include family and professional care partners, representatives from different sectors of the community, passionate community members, and most importantly, people who are living with dementia themselves. And that's part of our commitment, again, to a nothing about us without us approach. These various groups and our statewide effort, we work collaboratively to develop a lot of different local and statewide in-person and online programs that address important gap areas in our state. One of the programs that we provide online, so anybody anywhere in Nevada can access this program, and actually anyone anywhere with an internet can access this program. It's called Dementia Conversations, and it was developed in partnership with Chuck McClatchy and Nancy Nelson, who are both living well with dementia. Dementia Conversations are twice weekly Zoom-based public discussion forums that are co-hosted by a person living with dementia and a family care partner. On Mondays, I get to play the role of a family care partner. As I explained, my dad is living well with Lewy body and vascular dementia in Washington State, and I co-host this program with Chuck McClatchy. On Fridays, the program is co-hosted by Nancy Nelson, who's living well with cognitive changes connected to MCI, and Kat Hartley, who is a family care partner. In these forums, participants really drive the program, and they share their experiences and explore practical strategies for living well with dementia. And over the years, we've had more than 2,000 repeat visitors to these Dementia Conversations. And so they're quite popular and very effective. They're not support groups. We call it supportive education, but the participants really do form a supportive and respectful community. Well, over the years, we got an idea. We thought, these conversations are so incredible. What would it be like if we could capture some of these great ideas and strategies for living well with dementia on the page so that we can actually publish it as a resource to support people who have recently been diagnosed or for people who are living with dementia? So this idea led us to a particular body of literature called Chronic Disease Self-Management. We wanted to understand other programs in this space. What does this mean if we were to develop a resource to help people manage their own dementia? How can we learn from the science of chronic disease self-management to ensure that we're working in the right direction? So what we learned about chronic disease self-management is pretty interesting. It's a very dynamic process in which people manage their own chronic illness. We know people living with dementia are living with it sometimes for 8 years, 10 years, 12 years. I personally know someone who's been living well with dementia. I have a book published on my bookcase of Dr. Christine Bryden after her 20th year of living well with dementia. So while people are living with dementia, it's helpful for us to think about it as a chronic condition because people are really living with it for a long time. The other interesting thing we learned about chronic disease self-management is that it's really not just about working in isolation with yourself. And this was especially important as we started to dream about what a dementia self-management program might look like, understanding that people living with dementia often do rely on the support of a variety of different support partners in order to manage their symptoms. So, chronic disease self-management actually refers to the ability of the individual in conjunction with family, community, and healthcare professionals, not really self, but it's more like a interdependent kind of program, but to manage symptoms, treatments, to look at lifestyle changes that can help support them, to look at those psychosocial, cultural, and spiritual consequences of their condition. So as we really started thinking more about this, what might this program look like? And we looked at things like diabetes self-management programs and Fit and Strong and other really great self-management programs. We started to really talk about how dementia is such a complex experience. Everyone's experience of living with dementia is uniquely their own. Everybody lives with dementia differently. So in developing a resource, we needed to make sure that we were developing a lot of flexibility in that resource and that we're helping people develop these personalized strategies to promote self-management, recognizing that one person's strategy may or may not work for another person. And so this program that we dreamed about, we thought we could share, the latest information, both from the research literature as well as from the lived experience of our advisors living with dementia. We want this to be an encouraging and hopeful resource. And we wanted to share the best freely available resources across the United States and in Nevada, and with the aim to help people make important and positive adjustments to their diagnosis. One of the resources that we learned about in our early days of, dreaming about this dementia self-management guidebook comes from the work of Dr. Howard Gardner and his theory called multiple intelligences. Gardner is a developmental psychologist, and he actually outlines 8 specific categories that individuals may use to process and learn new information. And so in part of really helping people develop these personalized strategies for living well, we actually brought in the great work of Dr. Howard Gardner. And instead of calling it multiple intelligences, what we envisioned was that there would be multiple different ways for people living with dementia to engage with the content that's in the guidebook. We also wanted to make sure that this guidebook was reflective of the best science regarding brain health. And we believe that it's never too late for people to promote brain health. Brain health is for everyone. And so we worked in partnership with the Cleveland Clinic Lou Rufo Center for Brain Health to bring in their 6 pillars of brain health, which you see here on the screen, as being foundational concepts that we explore in the Dementia Self-Management Guidebook. The same strategies that help reduce the risk of developing dementia are the same strategies that can help support the brain health of people living with dementia after a diagnosis. And so thank you to the Cleveland Clinic for your partnership. The next thing we did is we brought in an expert of human-centered design from the UNR School of Journalism. Her name's Amber Walsh. And she became part of this project team to really ensure that the guidebook we're developing is people-centered, that we're really addressing the needs and the issues identified by our advisors, and that we committed ourselves to this process of continual refinement. So here we had an idea. We had the DEAR program's commitment to working in authentic partnerships with people living with dementia. And that's through, different, really being intentional about different supports and enablers for this partnership to flourish. And then we recruited our team of advisors who I told you about earlier, and we got started. The first thing that we did was we brought in the science of chronic disease self-management. And what you see here is just a rough outline of aspects that are generally included in most chronic disease self-management programs. information about, the particular illness, and helping people develop tasks and skills to take care of themselves in light of that condition, sharing important individual resources and community resources, and then really helping people develop the tasks and skills to help them live well with that condition. And so we took this as just an outline, and worked in collaboration with our partners living with dementia through a series of 6 90-minute meetings where we would develop content for each module, bring it to Zoom, meet with our advisors, share that content with them, both as a group and also individually, to get their feedback on important revisions that we should make to ensure that this is a positive and dementia inclusive and accessible resource. So this meant we had to maintain detailed records of all of this copious amounts of feedback from the advisors. And what you see on the screen here are just a couple of examples. But our advisors literally went through every single sentence. They selected every single photo in the guidebook. They selected the design and the format of the guidebook. This was hundreds and hundreds of hours of combined efforts. And it finally then produced this incredible dementia self-management guidebook. And I can say it's incredible because it's not my work. It is our work. And I'm really proud of the work that we have completed together. This is a guidebook designed by and for people who are living with dementia. So then we were able to secure a grant from the Division of Public and Behavioral Health in Nevada to print 2,000 free hard copies to disseminate freely across the state of Nevada. They were all distributed within a matter of 2 months. And so now we secured another grant, also bold funding from the Nevada Division of Public and Behavioral Health, to print another 2,000 copies of the guidebook because, people just can't get enough of it. In addition to people living with dementia who are receiving this book, family care partners have also found it incredibly helpful. We've actually had a lot of requests from professional care partners, even though neither professional or family care partners were the targeted audience for this resource. We're so grateful that they find it very helpful. And now we're using this guidebook as the basis of a new free grant-funded in-person and online dementia self-management program. And we're piloting it right now. The online program we're piloting in partnership with the Virtual Brain Health Center. And I'm going to tell you a little bit more because we're ready to kick off a second implementation online of this program. And our hope is to make this program also freely publicly accessible because we're at the university, we have a dissemination mandate. And so anything we're doing will always be freely available. The hard copies, unfortunately, are specifically for Nevadans, but if other people are interested in getting their own hard copies, please do feel free to contact the DEAR program and we could put you in touch directly with our printer here in Nevada. This slide just shows you that this beautiful resource is divided into 8 sections. And so the introduction, and then there's 6 modules that you see here on the screen. And then the end section is all about connections and resources. So module 1, we provide a really good but easy to understand overview of dementia. Module 2 helps people plan out their health care. Module 3, we really focus on lifestyle choices and again, promoting those 6 pillars of brain health. Module 4 is more of the psychosocial aspects of really making sense of dementia and making decisions about when and to whom you want to disclose your diagnosis to. Module 5 is really about creating community, breaking the stigma of dementia, connecting with others, and continuing to live a life of purpose, meaning, and growth. And then module 6 is really about focusing on the possibilities that you can live well with dementia. And so that's the general format. I just want you to hear from our advisors here. As we captured some really good video footage as a part of this process, asked them a number of questions. One of the questions that we asked is, how do you believe the guidebook would have helped you had it been available when you were first diagnosed with dementia? Because what we're hoping now is that across the United States and certainly across the state of Nevada, that when people receive a diagnosis of dementia, they will now have a really powerful, helpful resource to help them navigate what that means. And so here are some of my partners responding to this question.
So we walked away from that initial diagnosis shocked, because I just never thought that I would have a diagnosis of early onset Alzheimer's, and nowhere to go, didn't know what to do, and had a friend that introduced me to someone who knew somebody at the Alzheimer's Association, and I went from there, right? And then so if I'd had the book, I would have had a head start. I would have known maybe to call the doctor out and say, hey, just a diagnosis and come back, we'll see you in 6 months, doesn't work for me. Right? That's not enough. But I didn't even know that. I didn't know that.
I think it would have given me a little bit of hope. And that's something that I didn't have when I got my diagnosis. My diagnosis was, the doctor told me, go home, get your affairs in order. You have Alzheimer's disease. And so the first thing we did was try to look it up on the internet, and that will scare you, because my life expectancy from what they said was 3 to 5 years. So I immediately thought within a year I was going to be in a nursing facility. And I felt like I was the only one in the world that had it. And it wasn't until I got around other people, with it, that I finally got some understanding. But that was a period of time where you're scared to death. Everything that has been just completely turned upside down, and you have nothing to rely on. You have nothing to say, okay, well, this is what the process is. This is what is going to happen. This is how people adjust to it. We had to do it on our own. And I think that the most important thing is, I want other people not to have to go through what I did and have those feelings and be as scared and as just petrified as I was, until I got around other people. So I think that is the most important thing.
When I came to find the results of the PET scan that the psychologist offered, she said, come back in 2 weeks and I'll tell you the results. So when I came back in 2 weeks, she said, you have the beginning stages of Alzheimer's. How do you feel about that? And I said, well, okay. And I thought, I just wanted to get up and run out of there and cry, because I didn't want to have my family, not remembering them or anything at the end. And I was thinking, if I get cancer, I'm not treating it, because I'd rather die of that than dementia and not know my family and stuff. And I did have a little bit of hope when an eye doctor told me that her mother had Alzheimer's, and she told me of a book to look up, but it's nothing like we have here. It was just a research book. And this book, I think I would have, just jumped around and been happy right away, because it was in short sections, and it was very easy to read and did give hope to me.
I love what Barbara's sharing, that this dementia self-management guidebook is helping transform hopelessness into hope. And so let me ask you, using the chat box, I want to invite each of you to just reflect on this question. How do you think the guidebook might help people with their initial diagnosis of dementia? How might having a guidebook resource like this, and maybe it's not specifically this one, but one like it, but how might these types of resources really help people with that initial diagnosis? Let me tell you a little bit more then about our recent efforts. So we developed the Dementia Self-Management Guidebook. Let's see, I have a copy of it with me right here. You can see it's a rather comprehensive resource. You can learn more about it on the Dear Program's website. There's a QR code on the screen here right now where you can sign up to be notified when the free downloadable guidebook is available, which will be this fall, definitely sometime in October. So we are creating an online version of this guidebook, so anyone anywhere can have free access to this. So sign up by following that QR code with your phone. So if you just use the photo app on your phone and hold it up to the screen, you'll see there's a link right on your cell phone screen that will take you to our website where you can sign up to be notified for this. And you can also read more about the specific content in each of the guidebook modules. We are also aiming to develop a similar companion guidebook specifically for family support partners. And even though they find this one helpful, we think that there are some nuanced differences that would be worth developing a publication specific for support partners. Also, we are piloting in-person and virtual dementia self-management programs based on this guidebook. These programs are for people who are living with mild to moderate cognitive changes. And everyone keeps asking, well, when are you going to do a pilot with family care partners and people living with dementia? It's definitely on the horizon in the near future. But right now, as you know, with this first pilot, we just want to make sure that we've hit the mark in terms of developing a program that is really inclusive and accessible to people who are living with mild to moderate cognitive changes. And so it's only for people who are living with dementia. Participants must be able to participate in the program independently. And because there's obviously a reading component, there are activities or exercises, and people would need to be able to navigate Zoom a bit in order to participate successfully. People can register for the upcoming online dementia self-management program offered in partnership with the Virtual Brain Health Center by following that QR code that you see on the screen. The in-person pilot that we're offering will be based right here out of Reno in partnership with the UNR School of Medicine's Sanford Center for Aging. The online version is going to be offered on Wednesdays, so once a week, Wednesdays, starting September 27th through November 15th, and it's a 90-minute program, and you can see the time listed there. Just to give you a little bit of a sense of what this 90-minute weekly program looks like, and when people Zoom in or show up in person, we welcome our friends. They work with us to prioritize which key messages in the Dementia Self-Management Guidebook they're most eager to talk about, because in a 90-minute session, can't talk about everything, but we want to make sure that we're really tailoring each session to what's of most interest to the participants. And then we provide an overview of the agenda for the day. Then we actually center ourselves before we jump into the program to try to reduce a lot of the noise and distractions that are common in most people's lives. We align ourselves with a set of group guidelines that are introduced and collaboratively developed in the first session. And these guidelines just, remind us of how we want to be treated and how we promise to treat others in that group. And then we jump in and we explore those key messages through really engaging learning activities and discussion questions. And then the participants share how they engaged with the content in that particular module over the course of the last week. And then they reflect on what they're taking away from this particular module, and they commit to future action. Those future actions are all aimed at living well with dementia. And then we celebrate. We celebrate that it is possible to live well with dementia. We celebrate having the opportunity to be together as a community. So each group has developed their own special celebration ritual that they do at the end of the program. I'll just put up the Dear Program's contact information here. You can find us at www.dearprogram.org, or feel free to send us an email, dearprogram@unr.edu, or give us a call.